Go home and read up on it. You can sleep on it. Come next time and tell me if you want to do it. Today we can just do like heat and soft tissue. Like we can baby if you want to. It's up to you. And some patients are like, most of the time patients are like, I'm sick of this pain and I will do anything to get rid of it. And so mentally they're already there. Like I'm ready. Like let's do it. Last but not least, did you start the recording?
Yes.
Okay, thank you. So last but not least, I tell the patients like, you're the boss. I want to needle at least 1, 2, 3 spots on the affected side. If we can do that, it's going to loosen up all those muscles. But if after we needle one, if you need a minute or if you want to be done for the day, like that's cool. Like you're in charge. So the patient feels comfortable about what's happening. They know they have the reins and stuff like that. Does that make sense? Any questions about that? Do you mind if I draw on your face a little bit? You can wash it off when we're done. Okay, so there's a couple of structures that you want to be able to palpate so we can find our way around, okay? So the first muscle that we're going to needle is masseter. You guys know how we've taken our magic hands, magic finger, and we're just trying to find that muscle. So if you start kind of behind the lips, we know that masseter lives here. And so what you're going to have is cheek, 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 oh, masseter. If you're not sure, can you clench your jaw for me? Boom, relax. Watch what happens to my finger. Clench your jaw for me. There you go, there's the heartbeat. Okay, so there's masseter, and then we kind of fall off it back here. So it's a pretty wide muscle, right? And if you come and feel on the front of it, it's got some thickness to it as well, 1/4 centimeter, 1/2 centimeter. So if we can bracket on the front of that muscle and you feel muscle under your fingers, you're good. And you're good to go posteriorly. We've got like 3 to 4 centimeters. You can needle maybe 2 centimeters in, 3 centimeters in. There's nothing back there to be afraid of, okay? Like jawbone and stuff like that. So I don't usually needle full depth. I needle until I feel that I've gone into the muscle, and then you take it out, right? You can feel, like, first you gotta break the skin, right? And then there's like no resistance at all. That's like subcutaneous tissues. And then you hit a little bit of resistance. That's gonna be the muscle. So you just give it a little into the muscle, 1, 2, pull it out and done. Okay. So I'm gonna go ahead and just give you guys like jawline. Okay. This is this little bump right here. Can you open and close your jaw? See how, keep your finger on this little bump right here, and then if they open their mouth, the bump goes away. That's the condyle. Right? That's important for intra-articular needling. So we'll go ahead and just draw a circle there, right? Clench. There's the anterior border of masseter. Clench. There's the posterior border of masseter. Okay? You guys can easily find zygomatic arch. Right, that's the cheekbone. Does us no good to needle the cheekbone, right? So that's why we want to know where it is. Right? Okay. So we're gonna hit the masseter from the front. So this X is masseter. This X is going to be intra-articular. Clench your jaw for me. Relax. Clench, relax, clench. We have this big clench, fan-shaped muscle, temporalis, that lives in this big area over the ear. It even runs, how far back does it go, clench? It runs behind the ear, all right? This muscle is like super thin, right? Like it's ridiculously thin. And so I would say the best way to needle it is not like that. You know what? We might hit like one little bitty muscle fiber or something like that. So when I needle temporalis, what I usually do is insert the needle and kind of go along the plane of the skull, but clearly towards the skull as well, so that we can needle in and probably get 1 or sometimes a couple of centimeters worth of that muscle. So we definitely give it some input, okay? So masseter, intra-articular, temporalis, and usually I'll needle it kind of here in front of the ear. What structure is here? What's the structure that's here that you guys can think of, clue, that we want to not hit? Temporal artery. There it is. Okay. So if you can at least palpate that artery, then we're just going to not needle directly on top of that. So if that's the artery, I'm going to come up a little bit, maybe like a centimeter away from it, and we can needle there. All right. If you can't palpate it, maybe your patient can help you palpate it. What should you not do when palpating arteries?
Squeeze really hard.
Push too hard, because then you're just not going to feel a pulse, right? You've blocked the pulse. Okay. Then we got one more.
I'm good.
Yeah.
Oh my God.
Are you regulating well?
Mm-hmm.
Good. Okay. All right. So in y'all's books and pictures and stuff like that, there's another X for the pterygoids. Okay. The pterygoids are tucked under this cheekbone. Okay. And you may want to crack open an anatomy book later or look at that later. Look at a bunch of different Google images and stuff like that. But if we can come under the cheekbone about a centimeter and then needle superior medial, maybe like 45 degrees, then you can come up under the cheekbone and hit medial and lateral pterygoids, which is of the 4 muscles of mastication, there's 1, 2, and then pterygoids 3, 4. Okay.
About 2 centimeters in.
You can go full depth. You have a bony backdrop. It's kind of deep, probably at least 2 centimeters. You might be surprised. If the pterygoids is one, you guys want to save for. If you guys want to like look at some images and stuff like that, you can. But you can also take my word for it. Also, too, I don't know if in the lab manual I don't think I included like an anatomy picture from like a book or something. But you guys can Google it real quick and like look at it together. Okay. You good? All right. Thank you. Good catch. Good save. Somebody fix that for me. That'll be nice. I got you. And if after 1 or 2 sticks you're ready to be done, we can get another body on here, okay? No biggie. Right? All right, so there's our muscle. Go ahead and close your eyes. Count to 5. 1, 2, 3, 4, 5. Okay, I could have left it in. She did fine, but did you guys see that? Okay.
Yeah, do it again.
I'm not going to do it, but I'm going to show you, right? So there's my bracket. I found the front of that muscle. Spread your fingers. Put your tube on. I'm not going to do it. I'm just going to leave it there. Put your tube on. Tap. Remove your tube. Insert 2 or 3 centimeters. You know how big that muscle is, right? So you can insert 2 or 3 centimeters. Sit for a sec so we're not frantic and freaking the patient out. And then take it out. Maybe have your patients count to 10. Give yourselves 10 seconds to get the job done. Gives them something to do while you're putting a needle in their face.
Is your thumb on the mandible, like on the bottom of the...
I don't actually usually put another finger on.
I heard that.
That's usually what I do. But if you want to, for your own intents and purposes, if you come from here and push forward, see that muscle bulk? Like you can, if you just push along the bone, you're going to find the back of the muscle bulk. You could use a pinch technique here. It's just hard to angle it that way to get to your thumb. You know what I mean?
Sure.
So I would say just like that is fine. But if you want to have a thumb on, that's fine too.
Do you want to switch? I just wanted to see him mark on the face.
JC.
Do you want to switch
Do you
with
want to
her?
switch? I just wanted to see him mark on the face.
Are you good, or you want to switch? You can switch.
Sure.
If you want.
Can we switch?
Yeah,
Yeah.
of course. Yeah.
Appreciate you.
No, I get it.
So I'm gonna do the whole thing without lines, and you just have to like in your head know where, right? So, and I'm gonna do Masseter. Is that cool?
Yeah.
All right, cool. So once again, somewhere in here is Masseter, right? So we're gonna bring a finger, little baby one. Okay. So Masseter's like right here. If you're not sure, say clench your jaw for me, and relax. Watch my finger. Clench your jaw for me, and relax. Okay, so we're on the front of Masseter. So I'm gonna put 2 fingers on the front of that muscle bulk. Look underneath my fingers. That's muscle bulk. I'm just poking it out. Okay, so we are definitely in front of that. Okay.
Somebody should sing a song.
Can you sing a song? No, you can't sing a song. I'm not a good singer. And then just anterior to posterior. Sometimes your patients will like speak whale.
Do
When you're
not make
needling.
me laugh right now. Bro. Don't make me laugh right now. Not with a needle in my face. Ooh.
Just trying to laugh there. Okay. So that was Masseter. Where are we going next? Usually I'll do Temporalis and then the Pterygoids. Okay. We can see some veins here. So we're going to try to miss those, right? We are not going to hit a superficial vein that we can see ever. So it looks like I've got a little circle in here that I can go through. Let's see. Clench your jaw for me. And relax.
Do we have a picture of like temporal artery and vein? I mean, like on like. Can we? I think we showed
I think
that.
so.
We showed that in back when we were teaching back.
Maybe during lunch we can make it real dark and throw a slide up or something.
Just
So underneath my thumb right now is the artery. It's usually pretty low down, like this way. So like we can come up a little bit. And what I usually do is in the hairline
No, Lord.
above,
that's good.
avoiding any veins that you can. This is unique. You guys see what I'm doing with my thumb?
Did you already put it in?
Nope.
Oh, okay.
You guys see what I'm doing with my thumb here?
Yes.
So I'm going to angle the needle just ever so slightly towards her, I guess medially.
Oh, yep.
Tap it in, and my thumb is still there to hold that needle.
So you're way down
Right.
by your hair. Is that where the end of the needle is?
It's fun.
I don't go that superior actually because
Oh,
I'm so scared.
Lord.
So this is a system. If you want to see the picture, you want to avoid this fun stuff. Thank you for putting that up. You don't want to needle hair. If you needle hair, you're gonna have like bruising throughout the shoulder.
Oh, wow. Throughout
I've
the
seen
shoulder?
that like throughout the shoulder.
I have never seen that.
I mean, yeah, there have been. Yeah. Okay. So you don't want to needle this.
If you look here, so everyone's anatomy is a little bit different, but if you look here, you know, if this is most people, you see how in line with the eye is our artery and vein, and you want to palpate that. So if you can palpate that, you should have a pretty good window before your next major ones. You know what I'm saying?
I try to needle hair, and it's just personal choice because I feel like it's more safe. You see this gap? It's like right here. You can, but
Maybe
be
you
wary
can-
of the system because
maybe
you
you
don't know.
can make a video of that.
Yeah. So
When I took,
I'm more here.
When I took Dunning's course,
There's a gap here.
it was in this part of the world, and I like it. Like that works just fine, right?
Yeah.
Find the artery. If you look in line with the eye, the artery should be somewhere there.
Are you palpating it with your thumb?
I know.
Bad practice.
My thumb's a good listener. What can I say? There it is. There it is.
I think if you're staying below you can. I try to needle here, just safe because you see the vein. I think there's nothing here. There is a gap here where you don't find anything. You have no artery, no vein. So I try to go here, but
Yeah.
personal choice.
Yep. We can help with that one if you guys are worried about that one. Next is pterygoids. Remember how when you are shooting a needle, ideally, like you can, not shooting a needle, what? You can like angle it towards yourself. So from the jaw joint, we're gonna come, open your jaw. Okay, there it is, close it. We're gonna come forward along the zygomatic arch, maybe like a centimeter or two. How about we divide this area in half? Okay.
I
put
don't
it-
know about that. You should just do one. Are you gonna do it twice?
No, I'm just gonna do one.
Okay. Okay.
We can't, if I come right here on the zygomatic arch, we're just gonna needle the skin in the zygomatic arch. So we have to come down about a centimeter from zygomatic arch. All of these instructions are in the manuals, okay? Angle the needle about 45 degrees superior. And that's full depth. So we're coming up under zygomatic arch through pterygoids and hitting skull, okay?
Oh, thank you.
You good for one more?
Okay. Thank you, Tyler.
You're going to open your, so the way this one works is the intra-articular needling. I don't usually do this one unless my patient has chronic pain. If we've done a few sessions of dry needling and they're still experiencing like pain here, especially if they're like an arthritis, more like a sandpaper, like that, more like an arthritis-y TMJ joint, I will give them the option and say, hey, you know, you're still having some pain. If you want to, we can like do one more like needling spot and see if it helps you down. Okay, cool. Open your jaw for me. So we want to find and then close it. So right now I'm sitting on top of the condyle. When she opens her jaw, the condyle is going to disappear. So see how I can sink in now. You guys will feel it. Okay, so that is the space made by the condyle. Keep your mouth open. 3, 2, 1. Okay. Intra-articular needling. So how was that? Was that weird?
That
Was it-
didn't hurt nearly as much as like the zygomatic.
Yeah.
That one was chill.
Yeah. Okay. Okay. So we've got,
Should it feel worse?
no.
Okay.
I mean, everyone's different, right? Every stick. Masseter, Temporalis, the Pterygoids, and the intra-articular. The notes for these, the pictures for these are really good, but please, by all means, get eyes. You've needled some of these?
Yeah, once.
Yeah, okay. So you guys can use me and TJ for sure, if you guys want eyes on.